Ever find yourself staring at a tray of IV cannulas, trying to remember if pink or green is the right call for your patient? Yeah, we've all been there. Well, welcome to this explainer. Today, we're going to use a super memorable, highly visual day-to-night story that will literally lock those cannula sizes, colors, and clinical uses into your brain for good. Let's jump right in. Before we kick off our memory journey, let's quickly cover the absolute basics. So what exactly is an IV cannula? Basically, it's just a small, flexible plastic tube inserted into a vein to create a temporary pathway straight into the bloodstream. In fact, the word intravenous literally just means inside the vein. It's an absolute fundamental tool in medicine, right? But man, memorizing that specific color coding and sizing system can be incredibly frustrating. Or at least it is until you learn the day-to-night journey. Are you ready? Let's start the story. Okay, close your eyes for a second and picture this. You wake up early in the morning, look out the window, and see a massive, fiery orange sun rising right over the horizon. It's this intense, powerful explosion of orange light kicking off the day. Really lock that image in your mind. But you know how weather is. As the morning progresses, things suddenly shift. That bright, intense dawn light gets completely swallowed up by a heavy, thick, gray mist. It's a dense fog that just blankets everything around you. It gives the air this really serious, heavy-duty weight. Eventually, though, that heavy morning mist burns off. The sun does its thing, revealing a vibrant, really nourishing environment. So you step outside to take a nice walk on the bright, lush green grass at a local park. It's super grounding, just a standard, everyday kind of feeling, totally full of life and nourishment. As our day winds down, we transition into the evening. Imagine a calm, gentle pink sunset, just painted across a massive blue canvas of sky. It's peaceful. It's routine. It's that beautiful, calm transition away from the busy day. So notice that visual sequence. You've got the pink sunset, set right against the backdrop of the open blue sky. Then, night fully falls. The sky goes pitch dark, but you look up, and there's a bright yellow moon shining right down on you. It really stands out in the darkness. It's small, but incredibly bright, kind of like a little guiding light for the nighttime. Finally, the day is completely over. You go to sleep, and as you drift off, you imagine these tiny, super delicate violet galaxy stars scattered all across the absolute pitch darkness of space. They are literally the smallest, most fragile points of light in our entire story.
All right, so that's our story. Now let's break it down, starting with the morning, deconstructing the orange, gray, and green.
We started our day with the 14-gauge orange cannula. Remember that intense, fiery orange sunrise? Well, that explosive dawn light matches perfectly with what the 14 gauge is actually used for. This thing is massive. So when you see orange, think of an explosive emergency need for rapid fluid administration. We use this bad boy in severe trauma and shock scenarios where the patient absolutely needs a massive amount of fluids, like right now. Next up is the 16-gauge gray cannula. Now, in our story, this was the thick, heavy morning mist that covered up the sun, right? That heavy feeling is your ultimate memory trick here. Heavy mist means heavy hospital duty. The gray cannula is your go-to for major surgeries and massive blood product replacements. It's a serious, heavy-duty line for very serious medical interventions.
Then the mist cleared out and we went walking on the 18-gauge green grass. Grass represents growth and nourishment. And this maps perfectly to the 18-gauge cannula, which is basically your standard line for providing nourishment and vital fluids. It's absolutely the gold standard for blood transfusions and is super commonly required for CT scan contrast injections. You are going to see this size a lot.
Moving right along to the evening, let's deconstruct the pink and blue. Our evening kicked off with the 20-gauge pink sunset. Think about how a sunset feels. It's calm, it's normal, it's an everyday occurrence. This makes it so incredibly easy to remember that the pink cannula is the universal adult workhorse. It is hands down the most common choice for routine, daily IV fluid administration in calm, normal hospital duty. If your average adult patient just needs basic IV fluids or meds, you're almost always reaching for that pink sunset. And remember, that pink sunset was painted against a 22-gauge blue sky. The open blue sky reminds us of the need for gentle handling. The blue cannula is quite a bit smaller, and it's specifically indicated for elderly patients who often have very thin, fragile, or even rollable veins. Because the vein and the cannula are both smaller, we use this when patients require slow fluid drips rather than a rapid, heavy administration.
Finally, we reach the night. Let's deconstruct the yellow and the violet. So, in the dark night sky, we saw the 24-gauge yellow moon. The moon shines brightly, sure, but it's much smaller than the sun. The yellow cannula is meant for the little ones who shine brightly in our lives, pediatric patients. Specifically, we're using the 24-gauge yellow for children and toddlers who predictably have pretty small veins.
And last but not least, we drifted off to sleep dreaming of the 26-gauge violet galaxy. Those tiny, delicate violet stars represent the absolute smallest, most fragile things in our universe. This perfectly matches our most fragile patients of all, infants and premature babies. They have incredibly delicate microveins, and the 26-gauge violet cannula is uniquely designed to give them life-saving care without damaging those tiny pathways.
Now, this whole story brilliantly illustrates a vital medical rule, one that honestly trips up a lot of beginners. Pay attention to this. As the gauge number increases, going from 14 up to 16 to 20, all the way up to 26, the physical size of the patient and their veins actually decreases. It's totally inverted. A 14 gauge is massive, meant for adult trauma. A 26 gauge is microscopic, meant for a premature baby. So always remember this inverse relationship. A bigger number means a much smaller needle.
Let's bring it all together into the master chart, consolidating our entire memory journey.
Notice how seamlessly the day flows from top to bottom, 14 down to 26. Orange dawn, gray mist, green grass, pink evening, blue sky, yellow moon, right down to the violet stars. And right alongside it, the indications scale down perfectly from rapid adult trauma all the way to premature babies. Whenever you find yourself second-guessing a cannula size in the field, just pause and walk yourself through the day. By tying abstract numbers and colors to a really vivid visual story, you completely bypass the headache of rote memorization. Keep this story in your back pocket, and I promise you'll never grab the wrong cannula again. So I'll leave you with this one question to think about. The next time you step outside and look up at a calm pink sunset, which cannula size is instantly going to pop into your mind?